Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. We're talking today about the hope for cancer, and I like that, Well, first of all, Dr. Prather, how do you treat cancer?
Well, actually, we don't treat cancer. One of the things that is that we talk about, every time that we get on the radio, is that we don't treat disease. Mm-hmm. We're a structure function office, and by our very definition, we don't treat disease. Disease is a manifestation of certain symptoms, and they put them together to talk about a disease state. And we don't concentrate on the disease itself. What we look for is the homeostasis of the body. So it's more of a structure function, and we're not treating. So when we have a cancer patient in here, of course, we want to be aware of that and all the different types of ramifications, but we're not actually treating the cancer. So, that's a very big and important distinction between how we approach this.
Okay. So why don't we describe what structure function care is and disease care model, the two models that the FDA considers in healthcare, correct?
Certainly, and this is something that even quite a few people who are very, very familiar with healthcare, both on the, on what would be considered the alternative line, and then also as we talk about with the normal disease care line, is the differentiation between the two. And it is absolutely true. As you go into either a food product, a healthcare type of a product, the first thing that is determined, is this a structure function based product, or is this, or service, or is this a disease care? Mm-hmm. And what we mean by that is that the disease care is where you are working on the symptomatology of the particular issue. Mm-hmm. Like, as you get a diagnosis, all of those are disease care models, whether you're talking about MS, whether you're talking about a hypertension, whether you're talking about Crohn's disease. All those different types of aspects would be, as you're discussing them, that would be a disease care model. What the structure function looks for is the differentiation on homeostasis. What we're looking at is that the body is out of balance. Mm-hmm. And as the body is out of balance, it needs to be brought back into balance, because the balance or homeostasis is the definition of health. Mm-hmm. So, as the FDA described it to me, I am a disease care doctor.
No,
I'm a health doctor. Uh-huh. In other words, I bring people more into health. Disease is to help with the symptomatology and to actually treat the grouping of diseases that are put together. And truly, all disease care brings the body further out of homeostasis. Mm-hmm. If it doesn't do that, then it's not classified as disease care. The definition of structure function care is to bring things back into function. It's just a good example of that. We had talked about Dr. Oz last week. And one of the things that's very difficult for a lot of MDs is to get out of the thought pattern of disease care. Mm-hmm. So when they talk about a supplement, they say, this supplement is good for MS. Mm-hmm. Or this supplement is good for weight loss.
Oh, I see. Yeah, for a diagnosis.
Mm-hmm. And that is you can't do that. Mm-hmm. It's not scientifically valid.
I get you. Yeah.
That what these different products do is this detoxes the liver. Mm-hmm. Do you know what I mean? Uh-huh. This product does increases your metabolism. This product, but it doesn't treat a disease.
Gotcha.
And what the FDA really doesn't like, and I actually agree with them,
Yeah.
is that you cannot, and I really try to make sure that as I talk to people, in on the radio and in person, I explain to them, and it's a very difficult concept because we're so geared towards the disease care model. That's where
diagnosis-driven.
the diagnosis-driven. That it's hard for people to grasp exactly what I'm doing. So when people come in with different types of cancer and they talk about that, and what are you going to do, along those lines? Well, I'm not going to treat their cancer. Their body treats their cancer. What I'm going to do is I'm going to try to boost their immune system. I'm going to try to detox their liver. I'm going to do different types of aspects that I see is abnormal in their lab tests and bring those back into balance. And as I bring those back into balance, it's really the body who takes care of it.
So your diagnosis and structure function would be out of homeostasis.
Out of homeostasis, that's basically, what you're looking at. I mean, that's the...
And a lot of times, people don't have a diagnosis and are out of homeostasis.
Absolutely. It hasn't developed to the point where it could be classified as a disease. It's just an imbalance in the homeostasis. So people get very, concerned about different types of things. And I always tell them, as they get over different types of issues, your body did it. All I did was help to bring it back into proper homeostasis. It's not like pharmaceuticals, which treat the disease directly.
Interesting. Well, how effective is disease care for cancer?
Well, that's a big question. Whether it's worth it for people to be going ahead and going after the cancer, and it actually depends on the particular cancer.
Okay.
There is a tremendous amount of research on how effective the particular treatments are for different types of cancer, and some of them are almost guaranteed to work. I mean, they have 100% success rate, which is great.
Yeah.
There are some where it really, really doesn't make any difference. On the survival rate, from the statistics. That's one of the things that we try to help people to have a good grasp on. There is a site that we can get on where we can get all the research for all the different types of treatments for each different type of cancer. So as you come in and you talk about what particular cancer you have, we can bring up, and we don't actually discuss it with you, what we do is we bring up which is usually a big old stack that's several inches thick, on all the research on how effective each of the different treatments are for different types of cancer, so people can have a good understanding. Because there are some times that we present them on what the research actually shows for the standard for their cancer, and it's like it's a 95% success rate. Well, should I go ahead and do it? Yeah,
That's pretty good odds.
Those are pretty good odds. There are other different types of cancers where, at this point, they have found really that the treatments really don't make any difference, and the treatments themselves are actually quite devastating, for quality of life. So, then they can kind of read that and make an informed decision.
Right. We're educating the patient.
We're educating the patient on what the latest research is, on how well it works, and then they and their oncologists make a decision. One of the things is I do not offer my opinion on particular cancer research, on cancer treatments. Why? Because I'm not qualified. I'm not an oncologist.
Right.
I don't treat cancer.
Okay. But do you work with oncologists?
I do work with oncologists. That is one of the things. And actually, I have a very good relationship with quite a few oncologists. I've had them on at our office. I've actually gone and lectured to oncologists because I've been asked to. And the reason is because they've been very pleased with the results that I get. You know, what I'm trying to do is to increase the odds of the patient's health. And oncologists are very aware of the different aspects that affect the success rate of their survival of their cancer patients. They know that if the liver gets backed up, that's bad news. They know that if the immune system drops too low, that the patient's probably not going to survive. They know if the anemia gets too bad, then that cuts down on the chances of survival. And those are the things that I work with the oncologist to keep those functioning. So, you know, we're approaching this from two different aspects. The oncologist is going after, and they're experts in attacking cancer. And what is the best route to try to approach that? And some of them, you know, that I've worked with are brilliant people. The other way that we approach it is, well, let's keep the poor body healthy while we're going through that. And I go over all the supplementations. Now, one of the things that's interesting is I'm more aware of which supplements are going to interfere with their treatment, and oftentimes they are. So I know if they are on certain types of chemo or radiation, I can't give certain products because it'll actually interfere. Like, you know, if we do a certain herbal formula and the person's actually getting chemo, it's just going to flush it right out of the body before it can do anything.
Okay.
You know, because it's a detoxifier.
Right.
So I know not to use that. Now, once they're done with the chemo, then I can do that and get the rest of it out of there, and then we have a better survival rate. So, you know, I've been doing this for 30 years and working with oncologists and different types of products, and I know what to give and what not to give, and the oncologists really appreciate that.
When we come back, let's talk about what causes cancer. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice.
What I'm talking about today is the Atlas orthogonal technique, which is very dear to my heart. The Atlas orthogonal technique is really what saved my life. I had Graves' disease and was having a lot of difficulties with it. And I went and had an Atlas orthogonist adjust my neck, and within 3 months, all my health problems were actually gone. So that's at the time that I decided to dedicate myself to the pursuit of people's health, because I had such a relief along this. And the basis and the cornerstone of my practice is the Atlas orthogonal technique, which is a specific adjustment to the cervical spine, concentrating on the atlas as a lever mechanism. The area of the atlas, occiput, and axis is the most important area of your body. It is the lower brainstem, which controls all the autonomic nervous system, the whole nervous system that is beyond our mental control, and is considered by the body as the most important area. Any type of an injury to that area will cause instantaneous death. So looking at that and working with it can have a very, very huge impact on people's health and well-being. I actually was able to go with an intern with Dr. Sweat, who is the originator of the Atlas orthogonal technique, and was able to be involved in the complete development. I was in the original 6 who was trained in that. I am at this point the only board-certified Atlas orthogonist in the state of Indiana. It is a 3-year postgraduate work and can have a huge impact on people's health. Matter of fact, I consider that probably the most important thing that you can do to have the biggest impact on your health is to actually have your atlas put back into proper position. It is something that someone needs to have done, to have checked, and make sure that that's good, and should be checked at least once a year.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Well, we're talking today about the hope for cancer. And, Dr. Prather, we're going to talk about what causes cancer. Does it just appear one day, or sometimes people feel like it's so out of control.
Sure.
So what causes cancer?
Well, different cancers appear at different rates. The majority of cancers take a long time to actually develop. Mm-hmm. That's why older people, cancer is very common. It takes a long time to actually develop. Like prostate cancer, it's a good 25-year process.
Wow. Mm-hmm.
To get up to par.
That's why PSA,
sure.
blood work is very important.
Colon cancer, takes 10 to 15 years to develop. That's why the colonoscopies are so important, because you can catch it early. Mm-hmm. Breast cancer has a lot of warning signs before you develop the breast cancer. Mm-hmm. So most of the cancers take a long time to get to the point where they become cancerous. So, that is an important type of thing. And one of the things that I do is I look at the body, and one of the big things that we're looking at, the number 1, number 2 killers, cardiovascular disease is the number 1 killer, cancer is number 2. Mm-hmm. So I'm trying to, first off, as I look at the lab tests, is determine, are those two things going to occur in this patient? What are their chances? And it's very predictable. Just like I had one gentleman who came in, and I had looked over all of his lab tests. We had also done a stool test. And I sat there and I said, well, this is something you really need to address, because this situation that you're in is very conducive to developing colon cancer. Mm-hmm.
It was something on his the diagnostic.
Yeah, it was a combination of the blood test and the stool kit. He had some certain types of parasites that also lead to colon cancer. They were very well known to do that. I said, you really need to get rid of these and get this all under control, because your chances of getting colon cancer are very high. I also encouraged him to get regular colonoscopies, to make sure that was all taken care of, and then to address this and get rid of this situation. He chose not to. He really, he had gone to his regular GP, and his regular GP said, "Bull dinky." And he didn't. 5 years later, he had full-blown colon cancer, and came back and says, you told me, what do I do now? Right.
And how difficult would that have been? Just,
It really wouldn't have been too, it would have been a process, but yes, we're very effective on getting those things under control. I'm not just telling him that, to tell him that, but, the obvious signs were there. So, I look at a lot of different types of situations, and I say, wow, this person has all the makings of developing cancer. Different types of areas, and this needs to be fixed, this needs to be fixed. And I can tell those things. So, this is something that can really be very, very involved in really getting all these things under control. And there are very, very specific things that cause cancer.
Right. So it just doesn't appear one day.
It doesn't appear one day. You have to have different types of factors for cancer to occur.
Tell me, what are those factors that you're looking at?
Well, one of the things is lowered oxygenation. You know, if you are lower on your oxygenation to the body, then that's a absolutely huge factor.
How do you know if you are?
Well, one of the things is there's, you know, when you're talking about oxygenation, there's a huge different type of factor. Matter of fact, just on oxygenation, we had an entire show.
Right, and that's one of your
that's one of my 8 pillars of perfect health. So, you know, one, you have to take the oxygen in through your lungs. So you have to breathe deep to really be fully oxygenated. You have to have a good transport where it goes into the red blood cells. And the red blood cells, if you're anemic, that can actually lead to cancer. Anemia is absolutely huge. And, you know, when you're talking about cancer, breast cancer, colon cancer, several different types of cancer, if you are anemic, it would reduce your chances of survival by 50%.
Wow.
So
it's nothing to take lightly, and we talk about that. Yeah.
Right. I have so many patients who come into our office who sit there, and I sit there and I say, and you're anemic. And they go, oh, that's no big deal. I've been anemic all my life, and that's a huge deal. You know, the one that sets you up for cardiovascular disease because your heart's not getting the amount of oxygen, hypoxia. Your cells aren't getting enough oxygen, and that's going to set you up for the possibility of cancer. So breathing deep, getting the good blood flow, soft arterioles, so you have the oxygen exchange, starting to get some arteriosclerosis is a huge factor. And if you do have cancer, making sure that anemia is taken care of would really, really, like I said, 50% survival, difference in survival.
Wow. So how does toxicity affect cancer? You know, you talk a lot about the liver. Are you looking at the liver?
Oh, and the liver is very critical. Oftentimes, you know, as I'm talking to an oncologist, you know, because chemo and radiation really puts a heavy load on the liver. And so it's well known that if the liver starts to shut down, then, you know, we've got problems. So making sure that the liver, and you can tell that from the blood test, how well the liver's working.
But even before.
And absolutely before. Yeah. Yes. One of the big things that I look at is your liver's just not working up to par. We need to get that cleaned up because having a toxic liver can really set you up for cancer. As a matter of fact, there were whole clinics across Canada and the United States that were cancer-treating clinics. That
were when.
Well, you know how the FDA and everything, they were true. It was true. They were not directly treating cancer, so they couldn't claim that.
Oh, I see. Okay.
Do you know what I'm saying?
Is this recent or?
No, it was in the past.
Okay.
1920s, there was cancer clinics all over the United States and Canada that basically all they did was detox the liver, and they actually had a very high success rate. But was it a direct treatment for the cancer again? No, it just set up the body to be able to. So one of the things that a lot of people, you know, when they purport, you know, different types of treatments for cancer is detoxing the liver, and it's amazing how many people can get well just by detoxing their liver. The kidneys are also another important way to our detoxification for the system. So, you know, that's another thing that's important to make sure that that's going on, that the body...
Looking at all the different... That's what I like about our blood work. It's so thorough. It checks everything.
Sure.
And someone brought in blood work from somewhere else, and you were looking at thyroid, and it didn't have everything on there that you needed. Very
few times that people do a complete... doctors do a complete thyroid test to really find out what's going on. Happens all the time. I sit there and I feel the thyroid on the examination, and it's swollen. You know, it's palpable. It shouldn't be, and I know something's wrong. And they said, "Well, yes, you know." My doctor keeps checking it like 3 times a year and still keeps saying it's okay. But I have all the symptoms. And I said, well, let me look at the blood test, and it wasn't thorough. It wasn't a thorough thyroid test, and I do a thorough thyroid test, and I sit there and I says, yes, your thyroid is an autoimmune disease. It's got this, it's got that, and it explains so much. We get it fixed, and they feel much better. But not being thorough on the diagnostics is something that happens quite a bit.
Yeah, we could do a whole show on thyroid. We need, but we're talking about cancer today.
But cancer, toxicity. There's heavy metals. There's certain heavy metals. Cadmium is very heavy.
Cadmium.
Big, cancer-causing product. So heavy metals.
High levels of that.
Different types of infections, viruses, bacteria, parasites. Different ones cause different types of cancers. So looking at the whole toxicity, or even the hormones being out of balance. Estrogen dominant is probably the leading cause for, it's a combination for like prostate cancer, is estrogen dominance in a male. With a bacterial infection, most likely a tuberculina bovinum is the one that they actually feel is the one that causes prostate cancer.
Interesting.
So, when you're talking about what's going on with that, estrogen dominance with certain types of infections can kick off the breast cancer, uterine, ovarian. The hormone imbalance with some infections, it's a combination of things that always kicks off the cancer.
Interesting. When we come back, let's talk about how the immune system can be improved. Listen to the Voice of Health radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
And I realize that's the only time as an adult that I feel like a little kid, is when I go to the doctor. You didn't do what I told you, did you? No, I didn't. What should you have done? I should have listened when you were talking to me. What are you going to do from now on? Pay attention when you say things. When are you going to start? I'm going to start right now. Immediately.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.
Doctor, give me the news. I got a bad case of loving you. No pill's gonna kill my head.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We're talking today about the hope for cancer. And Dr. Prather, let's talk about the immune system and cancer and how structure function care helps build the immune system.
Sure. Your immune system, if it's working properly, you just won't develop cancer. So, absolutely critical. And one of the things that is a very big indicator that we always work with the oncologist is what is the white blood cell count doing, the neutrophils, lymphocytes, all those different types of aspects. And as that will drop, which chemo and radiation certainly can crash the immune system, the chances of survival decrease quite precipitously. So keeping the immune system
What
up...
was that word?
Precipitously? Sorry.
Spell that. No. Don't spell it.
The immune system is just absolutely critical. And the immune system will keep you from getting cancer. Mm-hmm. And if you have cancer, it is not healthy, mm-hmm. guaranteed. And if you can get the health of the immune system back up to normal, it will take care of the cancer.
And I know some oncologists send people over that are getting chemo because that is destroying their immune system, correct?
Absolutely. So we get referrals along those lines.
To build up the immune system during chemo. Mm-hmm.
Yeah, it's very, very important. And we have very definite ways that are proven to improve the immune system. And again, one of the things I always like to say is that these are not, sometimes I see these advertised as cancer treatments. Mm-hmm. Different things that can improve the immune system, and and that's, the FDA is correct. That is not true. Mm-hmm. It's an immune booster. Mm-hmm. And different ones have very different effects on each parts of the immune system. So what I do is I figure out what part of the immune system is gone, mm-hmm. and then hit the specific things that are involved with that. So it's not just willy-nilly.
Right.
Where one cancer patient, I need to use astragalus, mm-hmm. To help to boost the immune system. The other one, olive leaf, might be better. One might be a specific whey protein that's put together in Europe that's designed to boost certain parts of the immune system. Mm-hmm. In other words, it's a very complicated type of a process, and the success rate of the boosting the immune system is very dependent upon the knowledge of the doctor.
Right.
If you're just, in other words, you have to know what you're doing to be able to rebuild the immune system, because it's very specific for different types of problems with the immune system. So, mm-hmm. Being aware of that, doing the thorough diagnostics, and you have to do diagnostics to find. If you don't know how to treat.
Right.
And once
it's your blueprint to health.
Once you know, then you can really start to change around the immune system, get it back up to par.
Mm-hmm. Well, what about pH? What role does pH play in cancer?
pH is so important. Mm-hmm. Matter of fact, we have there are certain types of minerals. Matter of fact, minerals is the big key for pH. Mm-hmm. And there's this whole thought that acidity leads to cancer. Mm-hmm. And if you just do a whole bunch of alkaline types of things, then you will
alkaline water. Alkaline,
yeah. And the science really doesn't hold up on that.
Okay.
That's not really true. That's not really what's happening in the body. That's not what's happening with cancer cells. Cancer cells actually go alkaline. Mm-hmm. The body goes acid.
To try to balance it?
No, it's almost like the cancer. The best milieu for the cancer to grow mm-hmm. is an extremely alkaline cells with an acidic body.
Interesting.
And again, it's a matter of homeostasis. Mm-hmm. If you take in a whole bunch of acidic types of products into your system, will that set you up for cancer? Yes. If you become too alkaline, will that set you up for cancer? Yes.
The answer is yes.
It's homeostasis that works. Mm-hmm. And we are such an extreme society. We overdo everything.
Yeah, it's got to be black or white.
It's got to be black or white, or this mm-hmm. is good, this is bad. Nothing's good, nothing's bad. Mm-hmm. It's the balance of them. Mm-hmm. Balance is really what works, and it's a balanced pH in your water that is good for you. Mm-hmm. If it's too alkaline, it can set you up for cancer, and if it's too acid, it can set you up for cancer.
So how do we measure pH? What is the best way?
Well, the blood work, I get a tremendous amount of information on the pH, the mm-hmm. carbon dioxide levels, the urine. So I get a lot of information on pH. We used to have pH meters that would read those types of things, but to be able to do that, you have to be a CLIA certified office, which is very, very difficult to get. So we don't actually do a lot of the more advanced type of pH testing.
Okay.
And really the way that they can do it nowadays through different types of diagnostic tools is quite remarkable. That's not really that available to people. So, there are ways to do it. We do a very good job on finding out. But really, looking at the mineral balance is probably your best way to figure out what's going on.
The mineral imbalances.
The minerals. And one of the big things, cancer is really amazing because it has that alkaline pH of the cells with an acidic body around there. And then it actually makes an electromagnetic field around there that will keep certain minerals out, so that the cellular membrane of the cancer cells are impermeable to minerals. Because if you can get the minerals into the cells and you get enough of them, then cancer cells explode.
Wow.
And there are certain minerals that are very good for crossing the membranes. Two of the best ones are cesium and rubidium. Amazing. Matter of fact, the federal government is doing so much research on it, it's almost impossible to be able to buy them. Because the government's buying them all up. Because they're finding, a matter of fact, they're actually starting to add that to some of the chemotherapies.
Interesting.
Because
now, do we
of the
carry that
effectiveness.
here?
We do try to keep the cesium and rubidium in here, but it's very difficult. So we try to make sure that we can try to get that for those special patients. And extremely effective. But there are other ways that we can approach that. There is a whole line of calcium orotate, magnesium orotate. The orotates was developed by Dr. Hans Nieper, who had in Austria one of the most prestigious cancer clinics in the world, where people would come from all over and get excellent results. Also, there are arginates, aspartates, and you can put into different types of combinations on that depending on each patient, to try to get that across the cell membrane. So if you can, that does explode the cancer cells. But again, it's a structure-function concept on that, if you know what I mean.
Right.
And it's an excellent way to get things fixed. One of the things that I always like to put in there is distilled water. We call that cancer water. If you drink distilled water, your chances of getting cancer increase precipitously.
I was reviewing a detox program that this doctor's promoting, and that's the kind of water he wants people to drink. And
Yes. It's very scary. There's a lot of people who advocate that, and it's got a pH, redox potential, electromagnetic charge of cancer, and it's just...
put it in your iron.
Put it in your iron. That's all it's good for.
So how is toxicity in the body measured?
Toxicity in the body is... we look at a lot of different ways to measure that. Blood test is excellent.
You look a lot at the liver?
Liver is just absolutely critical. The kidney function is absolutely critical. How well the lungs are working, to be able to get through that. Also, trying to measure the infection level that people have. The bowels, doing diagnostics on the bowels, because the bowels is a big place where toxicity develops. If you have a toxic infection-laden bowels, you're going to be, you have to determine that.
Take constipation seriously, right?
Take constipation seriously. Also measuring your food allergy reactions. We have a specialized test to measure the level along those lines. How toxic are your foods? How much are you reacting to that? That plays a huge role along those lines. Hair analysis, we're looking for heavy metal toxicity. So it's a very involved type of a process to really be able to run through that from A to Z, so that you can get a good measurement of how toxic the individual is. And all those play a role. In thorough diagnostics, I always say, please, 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 let me do as much as I possibly can, because the more I know, the better our results.
Okay. When we come back, let's talk about the steps we should take if we or someone we love has cancer. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice.
I consider the blood work to be the blueprint to your health, and we've had several different radio programs on that and talked about how important it is to have at least a yearly complete blood test to find out where you are. The blood is the life force of the body. And it gives an amazing chemical picture of where you are with your health and can actually pick up all the different types of diseases that could be going on. So having a thorough blood test is one of the most important things and is recommended by everyone to make sure that your health is up to where it should be and can actually pick up any type of disease process before it becomes a major factor. So having a good blood test, a good thorough blood test, is one of the most important things that you can possibly have. One of the things that I implemented when I started my practice was a blood test that could actually cover any type of problem that was actually developed that someone could actually experience. So we came up with a profile, we gave it to the labs, but they said, wow, that's a pretty good profile. Do you mind if we offer that to other people? And I said, no, that would be fine, because I feel that that's something that could be very useful. And they named it the Prather profile. So I've actually met with other doctors before and talked to them and said, "You're Dr. Prather. Are you the Prather of the Prather profile?" And I say, yeah, because, they get a list of different profiles, and so it's actually now a national profile. So we actually have 52 different lab tests that are actually included in this profile. It covers everything from A to Z. In other words, any disease process that you could possibly have in your body, that will be covered by this particular blood test. So it is something that should be done by everyone, from no matter how young you are to no matter how old you are, at least once a year to see what your health is. If you have a problem, this will actually pick it up. And one of the nice things about that is it is actually covered by insurance. So very excellent way of actually finding out where you are, and if there are any hidden types of problems that are going on, this will actually show it up.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. Well, we're talking today about the hope for cancer. And Dr. Prather, what steps should be taken if you or someone you love has cancer?
Well, of course, finding a good oncologist, and don't be afraid to shop around. Kind of find out, see who you can have a relationship with, that you can communicate with, that you feel comfortable with their protocol. Make sure that they're willing to educate you. But finding a good oncologist will be very important, one that you can really relate to, because that makes a big difference. But also along with that, I would also highly recommend that someone find a structure function doctor to go along with that. They're not working against each other. They should be working with each other. both of them should be willing to coordinate their care. And what you're looking for the oncologist is to go after the cancer and kill the cancer, in the best way that they possibly can. And then your structure function doctor to help you to maintain your health while you're doing it. Mm-hmm. Because, even if you are successful on the cancer, afterwards you have to recover, you have, what is your quality of life? And if you are, because chemo, radiation can destroy your immune system, they're very toxic, lowers oxygenation, changes your pH. So all the things that can cause cancer are the exact type of things that you wind up with for the treatment of cancer. Mm-hmm. So, you can actually get rid of the actual cancer and be successful, and then get it right back again or another form just because of the toxicity of the treatment.
Oh, interesting.
Yeah, so. it's mm-hmm. Definitely something along the lines to be aware of, and your success rate on the treatments of the cancer are really enhanced if you are able to maintain your health and well-being. So your chances of survival are much better. Mm-hmm. But not only that, but your quality of life. Mm-hmm. Cancer treatments can be very hard on you.
I remember the cancer patient was in phase 4, pancreatic cancer.
Pancreatic cancer, yes.
Stage 4 came in.
Right, right.
And we were able to give him quality of life. Yeah, didn't he go to the amusement park the day before he died?
The week before.
Or a week before,
yeah.
With his grandchildren.
Right. It was a really interesting situation on that. He was sent to me, not that there was anything that could be done, but his morphine wasn't working anymore, so he needed pain relief. And it was recommended that he come in for acupuncture, which we did on him. And the oncologist called me and said, that's amazing. Because he had sat down and asked him and said, well, how's your pain level? He said, oh, fine. Mm-hmm. I'm doing really well. And he says, well, let me write down how much morphine you're using. He says, oh, I'm not using any at all. Mm. And, he had never had a pancreatic cancer patient that wasn't on, wasn't taking some morphine. Mm-hmm. It was all the acupuncture that took him completely out of pain.
Wow.
And he says, well, how's your nausea? How's all these different types of things? He says, fine. Mm-hmm. I feel great. And that's one of the things that they find, that if you are getting some structure function care, that type of thing, acupuncture, chiropractic, some supplements, that there's 85% fewer complaints by the cancer patients if they are getting structure function care.
Complaints,
like nausea, hair loss, fatigue, pain, all those types of things. So, even if you're thinking, wow, this isn't really going to help, I just believe in the pharmaceutical, the disease care model, mm-hmm. Just your quality of life can be enhanced so much mm-hmm. by finding a good structure function doctor, especially that during that time is when you would really need them. But anyway, a long story short, they had only given him, weeks to mm-hmm. live, and he went almost 6 months. Yeah, mm-hmm. 6 months. He did go 6 months. And the week before he died, he went to Holiday World with his grandkids mm-hmm. and had a great time. Mm-hmm. And when he died, they actually said this at the funeral, which you and I went to, mm-hmm. was that he just said, that evening, he says, I'm not really feeling that great. Mm-hmm. And they said, well, Grandpa, do you need to go to the hospital? He said, yeah, I think I probably should. So they got him in the car, and they were driving, and he says, I think I'm just going to lay back and mm-hmm. go to sleep, and just let me know when we get there. And so he laid back, and they arrived there. And when they got there, he had passed away. Mm-hmm. Mm-hmm. And what an easy way to go, and mm-hmm. a good quality of life on that. Mm-hmm. Much longer than what was expected, and the oncologist and the family all said it just had to do with this aspect of their care.
Nice, yeah.
And that's what's so important. Mm-hmm. He had those 6 months.
He was able to be alert. And
and not drugged, mm-hmm. Able to enjoy himself. I mean, he really just had a great time with his family.
Well, can cancer be prevented?
Oh, now that is just just such an important statement. It
was a question, though.
Yes. Yes, absolutely. That's one of the things that is just so true. There are certain types of cancers that there's just no way, and there's different opinions on what percentage. Mm-hmm. But, at the most, it's only 15% of all cancers can't be prevented. They're just, hard set in your system. Cannot.
15%. Okay.
85% of all cancer can be prevented. And prevention is so much better than actually getting into going through the treatments.
Those statistics are, when you think about it.
That's really
because I think
amazing.
The thought out there is, cancer's this thing that gets out of control.
Well,
and
once
I
you
have
it,
Yeah. But don't we all have cancer cells in our body?
Absolutely. Mm-hmm. Absolutely. And it's when the body is no longer able to handle them. We all have cancer. Mm-hmm. And it's something that only when our body is no longer able to function normally, being able to control everything, that's when we have the cancer take off and cause those life-threatening situations. So cancer can be definitely prevented, and there are definite steps that can be taken.
Let's talk about what are those steps.
Oh, excellent. Well, of course, diet is very important. You can't, obesity is a big cause of cancer, so you don't want to be overweight. So getting a good evaluation on that, making sure that you keep your fat percentage below 30%. 30% is sort of the magic number that once you go over that, your chances of cancer increase quite dramatically. Obviously, don't smoke. If you are a young person and listening, don't believe them that you can quit. It's not that easy. So never start smoking, and if you are smoking, try to find some smoking cessation. Keep your weight under control. You need to really eat your veggies and your fruits, just like Mama said. Really going along those lines. But also good diagnostics on a regular basis, because cancer does not sneak up on you. There are warning
signs. Would you say
signs.
Annually?
Oh, absolutely. At the minimum, an annual, good, thorough lab test, complete on that, is absolutely critical. Getting your colonoscopies, as you're supposed to, getting the breast checked, all those different types of normal types of checks along those lines is very important, because cancer is very, very preventable.
Right.
And having good diagnostics.
And the breast self-exams are so important. A lot of women find it themselves,
Yeah, that is actually the very best way. That's what they find is the most telling, most accurate, and that's where most breast cancers are actually found, is by the women themselves doing a regular check.
Yeah, now you talk about the 8 pillars of perfect health, and we've done a whole 8-part series.
Sure.
These are the pillars you've come up with in order.
Right.
And we only have a couple minutes left, so
you want me to go through all 8 pillars?
No.
I'm teasing.
But how do they relate to cancer?
Oh, absolutely, and all 8 of them have an influence on cancer. So, maintaining that perfect health on that, and you can live a long time. Now, there's no guarantees on everything. Obviously, anything can, but the percentage of chances, if you follow and do even a minimum on those types of things, keeping an eye on it, having a structure function doctor to help you. You don't have to do it all by yourself. People get overwhelmed with that. We need to ask for help for everything. I have an accountant who does my taxes. I have a mechanic who does my car. And, we need to take at least...
A handyman that does yours.
That's right, guard. Somebody... get these people who know what they're doing, doing their things.
Yeah.
But you know what? People take better care of their cars than they do their body.
Oh, yeah, they get a whole diagnostic report and maintenance.
Sure.
And, yeah.
I've got patients who take better care of their cats or their dogs than they do themselves, on getting checked up. Oh, I got my vet, but I haven't been to a doctor in 5 years to get checked.
Yeah, that's interesting.
So, where are our values, and where should we really be putting our time and money? And it's money well spent. It really can make a huge difference on how many years you live and the life in your years.
And the quality.
Quality, absolutely.
Well, we have about 30 seconds, Dr. Prather. What would you conclude if someone's listening out there that might have cancer or might have a loved one that has cancer?
Certainly, knowing that you have choices, be willing to find the people that can work well with you, finding the right oncologist that meets your needs. And also, I really encourage people to add that structure function aspect into it, and you'll see much, much better results.
Okay, well, thank you, Dr. Prather. Hope for cancer. The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather. Healthy Habits from the Prather Practice is a natural weight loss program with a proven success rate. Healthy Habits is an individualized program that is tailored to each patient's needs. Healthy Habits is not a trendy diet. The program actually resets your body's metabolism for optimal fat burning. The Healthy Habits program includes concentrated vitamins and minerals that help you to burn fat and feel more energetic. Healthy Habits provides support from a counselor and exercise physiologist in order to maximize your results and help you create new healthy habits in your life. This program even helped our own Dr. Prather to lose 24 pounds and shed 4 inches from his waist in just 12 days. Schedule your consultation with a Healthy Habits counselor at the Prather Practice at 317-848-8048. That's 317-848-8048, or on the web at thevoiceofhealthradio.com. The Prather Practice, restoring hope.